Perioscopy system requires using what we call explorers. There are 4 different explorers. This is a left explorer. It's indicated by a yellow band. The left explorer looks to the left. The right explorer looks to the right. These bent explorers are bent so they can look forward in the mouth. These right and left explorers can look to the sides of teeth and then look backwards in the mouth. And in the anterior, they could look to either side, the facial and, say, for in this case, the distal. The explorer has several parts. It has a handle, it has a channel, it has a cone socket, and it has a shield. So we're going to start using the left explorer and just talk about how you put the sheath fiber complex into the explorer. And this is also explained in the operator's manual with multiple pictures. So you hold the sheath fiber complex by the tip seal with the water tube toward the inside of your hand. You place the metal cannula or the window cell straight in, you twist it, and we're trying to twist this so that it seals the tip seal into the cone socket, and then also so that these 2 tubes are as parallel as possible going in to the channel. And the reason we want to have the fiber tube go in first is because when we take this out, it's much easier to take out with the water tube coming out first because it's smaller. This is how you're going to hold the explorer when you're using it. So this is how we recommend holding the explorer while you're taking the sheath fiber complex in and out of the explorer, because you will be changing explorers going around the mouth. So again, place it in, straight in, twist it, not with your glove in there. With your hand in the same place, you just snap it in the channel and you're ready to go. When you take it out the same way. Place it in, snap it in, snap it out. Pull it straight out gently. Okay, so we've got this ready to go. Now what we're going to do is we're going to be looking at the screen and having the screen guide our movements as we play this video game. If you look at the screen here, what you see is the end of the shield. Okay, those are my gloves. So when we play this game, you look down at number 1, and we're going to do it with the right hand first. So look down with number 1, and then we're going to trace this line, looking at the screen to govern your movements. But what this does is this helps you direct your movements looking at the screen. Then we do this with the right hand, or the left hand, or your non-dominant hand. Okay, because this is like when you use a dental mirror, you use your non-dominant hand. And when we use the perioscope, we use our non-dominant hand because we have an ultrasonic in the other hand. So now I'm going to take this out, and our trainee Katrina is going to be doing this next. So you want to hold on to the tip seal with the water tube toward the inside of your hand. place it in like that. Twist it the other way. There you go. And then just flip it into the channel from here.
Water on top.
Right. Don't move your left hand. Good. Okay, now put it in your right hand and just trace the lines. Again, this gets you used to using the screen to govern your movements. Because this is an endoscopic procedure, so it's all going by the screen. Now in the mouth, you are using some tactile sense as well. As you get better at this and you're moving along, you feel, you position in the mouth, you feel what your way around, but you're looking as well. Okay, good. So do it with your left hand. Good. Now take it out. And clip it right from where you put it in. Yeah. And pull it straight out. Okay, see how she's holding it just like she's going to be using it. Some people will end up doing this, and you know, if you're left-handed though, what we recommend is you put it in like you're a right-handed person, because this channel is not really conducive to a left-handed world. And the reason we're going to be taking the Explorer in and out each time is because this trains you to do it the same way every time. Okay, so now I'm going to put this in the same way. And we're going to look at the model. This Explorer will look to the distal lingual of the upper left, along the lingual, and then into the interproximal as you turn it sideways. As you can note, you can see that there's a shield, and looking at the screen, you can see that there's an angle here and there's an angle here. And what we want to do is try to keep those angles equal, because the more equal they are, the more you're going to see of the tooth. Because normally there might be soft tissue here, and the more soft tissue here is here, you're only going to see a small amount, whereas if you have equal amounts of soft tissue on either side, then you're going to see a larger amount of the tooth surface. So these we call an open and closed angle. We also have closed and open angles moving axially on the tooth. And then when we're interproximally, we also have closed and open angles. So there's a lot of times during the training where we'll be talking about close that angle, open that angle, and it's at various directions based upon how you have the Explorer positioned subgingivally. So what we're going to do now is this model kind of sticks down. And when we're working, we're normally working at 11 o'clock because that's the most efficient position for a right-handed person to operate in the mouth. So look in the mouth, position it at the distal lingual, and look at the screen and move around. When you get to the interproximal, we have to go sideways and go in. Then I'm going to look in the mouth. I'm going to position it at the distal lingual of the first molar, look at the screen, try to keep my angles equal, and then we're going interproximally. And then we're going to do that all the way up to the cuspid. then we'll be taking this out and putting it back in. If I'm using the right explorer, for example, the right explorer will look at the buccal aspect and into the mesial, or the lingual aspect of the upper right and into the mesial. On the lower, we don't use the red explorer that much, and the reason why is because it's not real easy to turn your hand like this to go to the lingual or to the buccal. So in the lower, and we'll get to this a little more, actually let me show how we use these bent explorers. These bent explorers will look forward in the mouth, so you can look at the distal aspect of the upper molar, upper left molars from the lingual, or the upper right molars from the buccal. So this array of explorers allows you to look and clean around each tooth. On the lower, however, because I can use the left explorer for the buccal and the mesial, the left explorer I can use for the distal and the lingual. We normally use 2 explorers on the lower and 4 explorers on the upper, especially in the upper molars, because upper molars are much wider, and you need to approach them from both sides. Okay, so I'm going to take this out, and then I'm going to have Katrina put the left explorer on and just go around looking at, go around the tooth and look at the screen. So hold on to the tip seal. The water tube toward the inside. That straight in, twist it, flip it into the channel, right from in here. Good. Now that's not going to move. So just look in the mouth, position at the distal lingual of the second molar. The second molar. Good. Now look at the screen and start moving around. Good. Now twist it sideways and go in approximately. Good. Now go to the first molar. Twist it sideways. We're typically taught to use instruments parallel, or as parallel as possible, to the long axis of the tooth. And that's what we do when we're endoscopically cleaning on the buccal and the lingual, but in the interproximal, you end up having to go perpendicular to the long axis to get interproximally. And then certainly the deeper the pocket, the more you're going to be going parallel to the long axis of the tooth. So look in the mouth, position the instruments, look at the screen, move around. Go ahead and take that out. Okay, the next thing we're going to do, and you'll note again, we're just going to be taking this in and out, so you get practice doing it the same way every time. The next thing we're going to do is we're going to take our model and we're going to position the endoscope or the perioscope right at the midlingual of the first molar. I'm looking at these different angles. Then I'm going to pick up the ultrasonic and I'm going to put it in what we call the visual field. I'm going to move around in the visual field looking at the screen. I want to try to keep the end of the ultrasonic in the visual field. I don't want to go out like that. I want to try to keep it in the visual field. Like for example, there's a little white spot right there. That could be a little bit of calculus. And you make incredibly small movements. This is maybe a total of 3 millimeters. And so we're able to see calculus that's maybe 1/10 of a millimeter. Calculus will tend to look white or yellow under this kind of illumination subgingivally. Okay, so we're just going to go around and try to stay in the visual field, looking at the screen. Okay, good. Keep moving around in the visual field. Now try opening this angle a little more. Good. Just looking at the screen. Open that angle a little more, more. Keep opening it. Good. Now close that angle. Open this one. Good. Now see if you're going to open and close the angle toward the tooth. There you go. Good. That's open. That's closed. Alright, keep the ultrasonic in there. When we're scoping, sometimes the ultrasonic is coming from the distal aspect, the mesial aspect, or just straight up. Okay, try to keep that in the visual field. Now make a little tiny circle right around the end of the pen. Little tiny circle. Smaller. And see how small these movements can be. Okay, make it over here. So what she's doing is she's looking at the screen, and the screen is governing her movements. She's looking to where she wants to go by looking at the screen. Okay, right there, that little white spot. Good. Over here. Great. What I'll do now is explain what instruments we use. We typically use an instrument that's magnetostrictive. Ultrasonics are either magnetostrictive or piezo. And it doesn't really matter what you use, as long as you use something that looks like a perio probe, a very simple instrument. About 99% or more of the time we use just one instrument. However, there may be times when we can't open up this angle enough to get this tip to move forward into, say, a furcation. Or on the lower, say we can't open this up enough to get underneath the CEJ here, because the mouth just doesn't open like that. Well, in order to gain that angle, we may use a curved ultrasonic. So it's important to have a straight one and two curved ones. So for example, if I want to get here and I can't open up this angle enough, I can just do it with a curved instrument. It's much easier. Same thing here. If I can't open up this angle enough, I can get in there with a curved instrument. Now all ultrasonics have a tremendous amount of power at the very tip compared to the sides. But you can utilize that power, especially if you're seeing what you're doing. And for example, here it makes it much easier just to use the tip lightly, to use that power to remove calculus when you're using these curved ultrasonic. Typically we're using just 3 instruments, straight and 2 curved. Once in a while we use these. The advanced set is the same instruments and they're diamond coated. Now this is a far departure from the typical periotherapy hand instrument setup. Periotherapy hand instrument setups have maybe an array of anywhere from 8 to 10 plus instruments, and they're all different angles to make up for the fact that you can't see. But when you can see, all you need basically is just one instrument and then maybe a couple extra. The initial part of the training requires that you watch a number of short videos on the Perioscopy website. That goes over the technology, it goes over how you put the sheath on, it goes over the explorers, and there are also videos on explorer positioning. And that's real important to watch the explorer positioning videos. And then we also have explorer positioning diagrams. These can be printed out in all 4 on one page. They can be printed out 1 on a page. When you look at these, this is the upper and this is the lower. And that's the reason is because when I look at patients, I look at them this way. However, if it's better for you to look at them this way, that's fine. Whatever works. I have one hygienist during her training, she took all of these colors and put them on one. So whatever works for your brain. Also, this is a two-handed, two-footed procedure. And so you're going to be running the water on the endoscope with one foot and turning the ultrasonic on and off with another foot. Now, some people would rather do contralateral foot. Like me, for example, I use my right foot to run the water for the camera, which is in my left hand. And I use my left foot for the ultrasonic, which is in my right hand. Whatever you're comfortable with, whatever your brain is comfortable with, is how you want to do it. So now what we're going to do is we're going to go into the patient treatment portion of the training.